Hey everyone, Tim Reha here live at the Digital Health Summit. We have one of our good friends and family, Donna from Caregiver Health, who's also really kind of making a name for yourself as an ePatient in the last decade. And what's going on here today?
Well, I think, it's always exciting to be part of the Digital Health Summit, and to be part of this summer series is really fantastic. An e-patient, most people identify it as a patient who is active online, so the E stands for electronic. But it's also about engagement and empowerment, and that's the work that I do professionally with Caregiver Health, helping companies that want to become more patient-centric and become more engaged with patients. But today I was really talking personally as a patient and about what it takes for me as a patient. My day in the life of a patient was the panel topic. And so from early morning through mid-afternoon through late at night, what do I need to do to stay healthy and active even though I live with multiple chronic conditions, and what technology supports me in doing that?
Interesting. So this is really from the patient side. Kind of drilling into the topics that you're speaking, what were the kind of the hot spots, the hot spots?
Well, I think that there is, an incredible advance in the number of mobile apps and devices and tools that are available to patients like me to support me, but there are still huge digital needs and gaps for coordinating the information that I generate as a patient. Even the term patient-generated health data is rather new still, but connecting that information to my physician so that it can really guide clinical care and turn from information to action.
And we're going into how busy physicians are, and now you have apps and all this extra stuff. What's happening in that space?
Well, I think it's important that physicians start to prescribe apps, prescribe technology support, and help patients navigate and curate what apps might be important for them. You know, so often we talk about physician workflow, and that's important, but there's a patient workflow and a patient productivity that needs to be respected as well, because it's not going to work no matter what the doctor tells me if they don't help me figure out how I'm supposed to do that, and it doesn't work with everything that I'm doing in terms of my work life and my family life, and even dealing with my pets and just enjoying the life, because what's the point of doing all of this if it doesn't give me a richer life in the end?
What are you seeing out there? What's working and where are the gaps?
I think that what's working are, I talk about my Withing scale that I use to measure my fluid intake. I have inflammatory bowel disease, so keeping that. And we've been able to show the graphs to my doctor and really calibrate how I'm doing well, how I'm not doing well. And in some things, it's changed the conversation, because it's not just, oh, maybe you just sort of feel that way, to look at the data on how I'm changing day to day. There are also things a little more 30,000 foot about how patients are starting to drive the discussion in clinical trial design and development and recruitment. So you see things like registries for all, or you see smart patients that Ronnie Ziegler, who had formerly from Google, has started with the co-founder of an oncology community. So we're seeing some patient-created and patient-driven solutions, and that's really exciting for me. So we're not just sort of the end users of these, but we're also the creators and innovators in this space.
Yeah, because we're the consumers of the services. What brings you down here? We have a great family with the Digital Health Summit group. What types of folks here and everybody out there that you could connect up with?
Well, there's a reason that I come all the way from Washington, D.C. Out to California to connect in this way. I think it is so important for us to get the entire ecosystem right. So what I hope to do is connect with people here, whether it's someone who's creating a new technology or funding a new technology, really being able to understand what needs they have from a regulatory and policy standpoint, what barriers do they have to bringing their innovations to patients like myself, and how I can work in Washington, D.C. to help smooth the path so we all really can take advantage of the incredible innovation that is so abundant here at the Digital Health Summer Summit.
Now, it always blows my mind, the stuff that comes out here. How do people connect with you?
I am DC Patient on Twitter, and I can be found at dcrier@crierhealth.com, and I look forward to connecting and helping with as many people as possible.
All right. Well, thanks so much. Love to have Donna, part of the family here on Digital Health Live, and good to see you again.
Thank you so much. Great to see you.
Cheers.